Shall we go on to the next one?
Yes, Joseph, are you able to say hello and briefly? Yeah.
Hi, yeah. My name is Joseph. I'm currently doing my master's in epidemiology and biostatistics at the University of Western Ontario. Currently, my research focus include clinical and pharmacoepidemiology, and currently assessing adverse events related to renal safety in older patients who are prescribed with common medications.
Terrific. So you're doing similar work to what Amir is doing.
Mm-hmm.
Okay.
Okay, Lawrence?
Hi, can you hear me?
Yes.
Okay, my name is Lawrence. I'm a public health physician from Cameroon. I'm doing a PhD in health research methodology at McMaster University. And my research is on using mobile phone text messages to improve adherence to HIV medication. Thank you.
Terrific.
Rebecca?
Hi, my name is Rebecca. I'm doing a master's in health research methodology at McMaster University. And my project is on adherence to medication, interventions to improve adherence, and its methodology.
Thanks, Rebecca. Russell?
Wonderful. Shall we go back and see if Benji has sorted himself out?
Oh, he's going through an audio test right now, so we'll go back to him. Yeah.
Russell.
Hello, my name is Russell. I'm a clinical pharmacist based out of Halifax, Nova Scotia. I'm doing my master's degree in epidemiology here at Dalhousie University. Like Rebecca, I am looking at adherence, specifically to statin medication, and just a few factors associated with that. Thank you.
Samantha?
Hi. So I'm doing my PhD now at the University of Waterloo in the School of Pharmacy, and I'm focusing on a folate receptor targeted system for gene therapy of ovarian cancer.
Wow, wonderful. Very high-powered people we have on board here.
Thanks. Shannon?
Hi, I'm Shannon. I'm a PhD candidate at McMaster University in Eric Brown's lab, and in the Department of Biochemistry, and we're looking at identifying novel antibiotics or chemical matter that inhibit microbes.
Thanks, Shannon. Simon, is your microphone working?
Hi, I'm Simon Chernitsky. I'm doing a postdoc at the University of Calgary. We're looking at a number of agents to increase remyelination in multiple sclerosis. For example, prolactin is one of them. We're also looking at quetiapine, which is an atypical antipsychotic. Thanks.
Great.
Thank you. Thuva.
Hi, I'm Thuva Vanyasingham. I'm pursuing my master's in statistics at McMaster University. And my thesis is in biostats, so my research includes determining a prediction model to predict the occurrence of a major adverse cardiac event within 30 days after vascular surgery.
Right.
Thank you. And Ursula.
Hi, my name is Ursula Amstutz. I'm a postdoc currently at UBC in Vancouver, and I have a background in genetics, and currently I'm working on pharmacogenomics of different adverse drug reactions, finding genetic predictors to identify patients at risk for adverse drug reactions such as drug-induced skin reactions and also adverse effects of different chemotherapy drugs.
Terrific.
Thank you, Ursula. Okay, so I think that's, we have someone else. Benji, did you want to try to say hello? Or is your microphone working? Yes.
Can you hear me now?
Yes,
hello?
Great.
Oh, perfect. Okay. Hi, I'm Benji Heron. I'm a postdoc fellow at the University of British Columbia. My background is in critical appraisal of randomized controlled trials and systematic review and meta-analysis. And now I'm currently receiving training in pharmacoepidemiology. And I'm currently looking at the safety and effectiveness of COPD drugs using administrative databases in British Columbia.
Great.
Thank you. And I did notice that Sham joined us. Sham, did you want to say hello, or is your microphone working?
Hi there. Can you hear me?
Yes.
Yeah.
Oh, hi. Yep, so my name is Sham. I'm over at St. Joe's. I'm at McMaster University. I am a PhD student in infection and immunity, more of a basic science background. And right now I'm working in translational, a bit of translational medicine.
Great.
Thank you very much.
Well, we have a really distinguished group of graduate students and postdocs. It's going to be fun.
So I don't know whether you wanted to just start out with maybe describing the work that Grand Challenges is focusing on today, or whether you want to just get a first kind of impression from everyone of what they thought of the book, or what how you wanted to start things off.
Maybe I should just say a few words about the book itself first.
Sure.
And then we can spend a lot of time on Grand Challenges later, and in between perhaps I should see if there are any specific questions. So this is a book that I co-authored with my friend and colleague at University of Toronto, Peter Singer, and it was written specifically for a non-specialist audience to make it more accessible to the public and also to students. And it talks about our journey in global health over the past decade. It begins with our personal stories. I was born in Africa and got into medicine, then switched to global public health, and described in the book how we ended up in Toronto. Peter is of a Jewish-Hungarian background, so we are both immigrants to Canada. He was born in Toronto, though. And we describe how we came together at the University of Toronto and embarked on this decade-old journey to try and get people to focus on the needs of the developing world on the one hand, and to use emerging life sciences as one of the major tools to approach those conditions to improve health. And also towards the end of the book we talk about how there were opportunities for reducing poverty. And we begin by talking about the inequities that there are in the world, how life expectancy is so different in different parts of the world, and how there is a kind of obligation on those who are fortunate to work with those who are unfortunate and help them, and perhaps in the process learn a little about innovation that might be taking place in the developing world. We talk about ethics of research. We talk about public-private partnerships and the issue of building trust. We document some important developments in the area of biotechnology in India and China, and then we do the same in sub-Saharan Africa. We talk about success stories and failures, and towards the end of the book we then come to talk about Grand Challenges Canada, which has now grown to be a very significant part of our work. And I guess many of the people on the panel today will have come across it in one way or another, either in the media, or perhaps there might have been applicants to one of our grant mechanisms to get money for their research. So that's what the book is about. There's a lot more than that, obviously, but that's in essence what it's about. And I think I'll stop now and get people's impressions about the book, or get some questions that I'll try to answer. And I'll leave it to you to moderate.
Okay. Well, we do have some questions that people forwarded, so maybe we'll go through those first, just because I wanted to make sure they were addressed before we ran out of time. Unfortunately, Bernice is not here today, so maybe I'll do her question last. She couldn't make it, but I do have others. Sham, you had this question. Maybe you wanted to read it out to the group, and we can get Abdallah's reflection on it. Go ahead, Sham.
Looks like we've lost Sham.
Oh,
Do you want to read it anyway?
Sure. Yeah. Sham, are you able to hear us, or maybe not? Okay. All right. Well, I will read it. This question. Thank you. Thank you for your unique perspective presented in the book. In the research, we are always faced with unexpected outcomes which require us to be able to think, adapt, and resolve. What would you say has been the most significant unexpected outcome since the initial conceptualization of the grand challenges? Has it caused you to significantly rework the way you think or your approach in this project? And how did you deal with this unexpected event going forward?
Thank you. That's a lovely question. I presume that by unexpected, one could think about both the negative and the positive. The unexpected negative, I think, was the resistance that we had in the early days of people in the developed world who should know better, who didn't seem to realize that there was huge potential of the life sciences to help improve global health. They were thinking only of boutique applications that might be applicable to the rich, things like pharmacogenomics and pharmacogenetics in a very narrow way applicable to individuals. It was difficult to get them to conceptualize the fact that genomics and proteomics and other omics and other types of life sciences could be used to improve health through the creation of vaccines, new drugs, new diagnostics, other kinds of interventions. So that was, in a way, totally unexpected for me. The positive unexpected, I guess, was the fact that just a few years later, people like the institutions like the Gates Foundation, when they were thinking about infectious diseases, ended up funding a large number of projects that were doing exactly the kinds of things that we had envisioned would be done. And we were therefore pleasantly surprised that there was significant amount of funding available to address very difficult questions, but many of the approaches were of the type that we had described in our initial science paper and that we had been arguing about of the application of genomics and so on. So on the one hand, the original negative reaction made us even more fervent in our approach, and then when the change came about and there was good funding and we were involved in that, partly because we had been making those arguments for the past previous years, we found ourselves in a way pretty prepared to deal with the issues that arose. And so it became altogether a positive thing. I don't know whether I've answered Sham's question there adequately.
I think so, and I didn't know if anyone else has any comments to follow up on that. Please feel free to jump in at any time. We want to keep this informal as possible. So, Sham, is that? Yes, thank you, he says. So that's great. Thank you for that. I'll just move on to the next question from Shannon. Shannon, I think you're, Shannon here? Maybe not. I think that's another one. I'll have to read out her question.
Okay.
As researchers, each of us are usually only one small link in getting science from the lab to the village. How can we as individuals try to make sure that our research has an impact on global health and benefits those who most need it, regardless of our expertise or where we fit in the pathway from lab to the village, which I think is a common question that everyone here shares. So thanks, Shannon.
Sure. And let me go back and say why we wrote this book. one of the main reasons was exactly this kind of question from our students, both undergraduates and graduates. And we thought that by talking about part of our experience over the past 10 years, since it encompassed such a wide area of global health, ethics, commercialization, trust, building companies, understanding needs, community engagement, clinical trials, etc., we would demonstrate the potential entry points for students and graduate students and professionals. Because quite often, even if you work with a supervisor in the laboratory, for example, as several of the panelists today are doing, it's quite possible you don't know the totality of what constitutes global health today and how that might be changing frequently. You know, several times a year there will be major events, new ways, for example, of funding research, new ways of funding vaccines, new ways of developing drugs, etc. You may not be familiar with those unless you're a voracious reader and have a source of information that's tailored to your needs. So that's one of the major reasons that we wrote this book, to illustrate the multitude of entry points. So as an individual, I think it's important to identify entry points that match not only your skill set, but through partnerships, through linking to different groups, or even finding a different mentor after you finish your PhD, to be able to find something that you're passionate about. So you need both a skill set and passion to do things in a sustainable way and to do them well. So the book perhaps illustrates the areas where you might want to transition to after doing whatever it is what you're doing, and there are enough subjects there for people to identify where they might find a passion. So that was the purpose of the book, and I think that by creating the kinds of innovative funding initiatives within Grand Challenges Canada, for example, our Rising Stars program for people initially only in Canada and then later on throughout the world, where anybody who has any good idea could come to us with a 2-minute video, very easy to apply, load it up online, and it goes through peer review by CIHR. And if you succeed, as many have done, then we'll give you very significant money just for the idea, $100,000. And then if after a year you produce proof of principle, then we'd give you up to $1 million. So the idea that as a young researcher, you might have a brilliant idea that in the past you could do nothing about, but you're very passionate about it, we gave you a means of realizing your dream. So that was just one of the kinds of things that evolved from our experience in the previous 10 years that we brought to Grand Challenges Canada. And so the answer really is manifold. Keep in touch through perhaps social media. Twitter is a great way to keep in touch in a focused way by following people who have the interests that you have. And identifying what matches your skill set with your passion, and then talk to people, apply for funds. The book also discusses meetings with a lot of remarkable people, and those are the kinds of people that you could write to and say, my interests match yours and this is what I want to do, give me advice. I think that quite often young postdocs and PhD students are rather shy of going across from their own supervisors to ask advice for what they might wish to be doing after their PhD. I've always said to my students, when you're doing a PhD, remember that the most important thing is you are learning methodology, you are learning the rigors of science, you are learning about honesty and gathering data and analyzing it, but it doesn't have to be in exactly the same thing that you did your PhD in when you've graduated. Just find other things to do beyond that, but you've now been totally prepared with your PhD and move on to some other bigger challenges that arise in associated or quite different areas. So I hope that I've covered some of the issues behind the question from Shannon.
Oh, definitely, and some really valuable advice there. Does anyone have any questions or comments related to that?
Hi, it's Russell.
Go ahead.
Just a comment.
Hi, Russell.
That is exactly what I needed to hear, so thank you.
Oh, wonderful.
Anyone else? I know that, well, even your book alone has contained so many examples of those types of encounters that have resulted in some great innovations. So,
And you know, honestly, a lot of life is totally unexpected. You think that you have a plan for your life, and one day you meet somebody in a pub or in a coffee shop, and a conversation just changes your life. I think another secret to this is to be open to ideas and to be open to learning from what appears to you to be the humblest person. And to learn to listen. The art of listening is not something that our species has developed much. We really all need to learn how to park our ego a bit every now and then and listen to people and try to see things from somebody else's perspective.
I noticed that Shannon
another question?
Shannon actually just joined a minute ago, so Shannon, you'll have to listen back to the recording because we just took up your question. But if you had any follow-up items, some really valuable advice was just given out based on that, so thank you.
Okay, thanks.
Okay.
Okay, I'll go on to the next question. Amir, do you want to go ahead and read out your thought? Yeah.
Sure. First, I would like to thank you, Dr. Abdallah Daar, for being here and taking time to share his thoughts. And thank you for some of the previous suggestions. I think they really apply to me as well. My question is more of a general one. Obviously, living in the developed world, such as Canada or United States of America, we have been, over the years, very effective in eradicating some diseases which used to kill people, such as malaria or tuberculosis, and we've also been pretty successful at keeping under control other viral infections, such as HIV, for example. And this is not the case in the developing world. There's still a lot of problems there, and there's still a lot of cases of malaria and TB or HIV that kill people. So despite all the money that we have poured into world organizations that help donate money into the developing countries to help with some of those diseases or conditions, we have not been able to, for example, eradicate malaria or TB from Africa, for example. There are still cases where people die because of that. So with all this money that the world has spent, which I don't know exactly how much it is, but I would assume it is probably into the millions, why can't we just implement some of the same strategies in the developing world which we know have worked for us and eliminate some of these problems instead of just treating them and then them having to come up every now and then?
Yeah, that's a really, really nice question, Emir. So first of all, let's look at the long-term trends and how do we compare today to the past, even just 2 decades ago. we know that infectious diseases were the main causes of death in much of the developing world. But today, we see that apart from just a small handful of countries in sub-Saharan Africa, in most of the rest of the world, infectious diseases are not the main causes of death now. The main causes of death now are what we call the non-communicable diseases, which we talk about in chapter 3 of the book, and those are cardiovascular disease, mainly stroke and heart disease, type 2 diabetes, chronic lung disease, and cancers, which share the same kind of risk factors as the other diseases here. And those risk factors are really very simple. We know what they are. It's a lack of exercise, smoking, under and over nutrition, and to a smaller extent abuse of alcohol. So most countries now have transitioned to this situation where they're dying from chronic diseases and not infectious diseases. Now, that's good news and bad news. It's good news in the sense that most of the infectious diseases have in some way been controlled or eradicated, even in much of the developing world. Now we know there are some emerging diseases that are going to be bigger problems in the future. For example, dengue, tuberculosis has not been completely eliminated. Even in Russia, even in the Western countries, drug-resistant TB is still a problem. But if we focus on malaria, the number of kids dying of malaria, and most of the people who die of malaria are children, and most of them are in sub-Saharan Africa, then the numbers have dropped quite a lot. In the past decade, I think 30 to 35% drop. And what has been the reason for that? One of the reasons has been the availability of insecticide-impregnated bed nets, which are available very, very cheaply, which are distributed very effectively in sub-Saharan African countries. Most of them are made by that one company that we describe in the book as a great success story, a company called A to Z, which is in Tanzania. They make 30 million of these bed nets every year. And then better availability of good drugs. So we went through a period when people were dying because we were still using chloroquine, to which most of the falciparum malaria, which is the main type of malaria in Africa, had become resistant. So now we have combination drugs which work pretty well, and the fact that there was this global fund which is providing money for people to buy those drugs at very, very low cost, subsidized by developed countries and the Gates Foundation and others. Plus the fact that there are now in many countries doctors and the members of the public who know about the treatment of malaria and can treat it early. So the trick is to get it early. The ultimate answer, I think, for malaria is going to be a vaccine, one or more vaccines. Now we know that there is a vaccine that will be licensed in about 2 years' time. It's already been shown in clinical trials to be relatively effective, about 60% protection. It reduces the number of severe episodes of malaria, and so it reduces the number of deaths. And that will be available in about 2 years. But I think even more importantly is that there are other vaccines coming behind that. So I think in 10 years' time or so, we will have vaccines that will make malaria history. I think the reason that we haven't been as effective as in the developed world, which is mainly in the north. So if you take the United States, one of the reasons that the Centers for Disease Control in Atlanta was created was to rid the southern part of the United States from malaria. And that was in the Second World War or around the Second World War, so quite recent. And they did that by draining the swamps, by using DDT to spray the walls and outside, using bed nets and so on. And because the mosquito does not survive very well in northern climates, whereas it survives very well in tropical climates, there was not much transmission, so it was possible to eliminate it from the United States rather quickly. The reason we got rid of things like yellow fever was simply because we had a fantastic vaccine that worked. So I think we need to look at it case by case and then take a long-term perspective. And I think using the long-term perspective, we can see that things are actually getting better with infectious diseases. But we should always be aware that new things will come up. HIV came as a surprise in 1982-83. Nobody knew anything about it. And now we have got a handle on it, but I don't think it will go away until we develop a vaccine for it. Or we find a miraculous way to change human behavior, particularly the behavior of men. I think if men behaved well, HIV would be a much smaller problem than it is. It's not a problem of women. Women are the victims in this. So there are, I think it's useful to look at them individually and take a long-term perspective. But, I think on the whole, things are moving in the right direction with infectious diseases. I hope I've covered some of your points, Amir.
Yes, I think that's pretty much covered the whole spectrum. Thank you.
Thank you.
Does anyone have any questions based on what was said? I'm just wondering, the vaccine you mentioned in 2 years, has there been discussion about the cost and delivery of that, or?
Yeah, that's a very very good question. I gave a talk in Korea just 4 days ago, and that was one of the questions that came up frequently. So this vaccine, some of the trials and some of the development is being funded by the Gates Foundation. And the understanding there is that the company would make it available at very low cost to people in the developing world. And of course, it will also be, I think, available through funding from the Global Fund. The Global Fund for Malaria, Tuberculosis, and HIV is a massive and very successful entity that has funded and lowered the cost of drugs. And then, of course, there is no reason why companies in the developing world or emerging economies like India could not make this vaccine if the company was willing to license it out, which I think it probably would be. So I think that it's pretty likely that it will be available at affordable cost. Otherwise, there would have been no point trying to develop a vaccine like that and then try to sell it to the very poor in sub-Saharan Africa, where most of the problem is, because nobody could have afforded it. So the fact that it is moving forward, it is being funded, the clinical trials are going ahead, means that they do mean to sell it at low cost or make it available at low cost.
Great. Well, I guess I think we have one more prepared question. Let me just see if I can get it to forward. Yes, Simon, are you there? Can you say your question or out to the group?
Yeah. So in Chapter 6, there's discussion of the Chinese biotechnology company that is injecting stem cells into patients without first conducting any randomized controlled trials to establish efficacy and safety. On the surface, their approach makes it look like this company has something to hide. What is your opinion of this research and the claim that stem cells are effective for the treatment of neurodegenerative diseases?
Yep, Simon, I can see why you focused on that, seeing as you're working on multiple sclerosis. So I go to China quite frequently, and this year I've been twice, and this is one of the things that I am very interested in, and what the Chinese authorities are doing about it. As it happens, they're taking it very seriously. The Chinese authorities are now demanding that no one should be claiming things that are not backed up by evidence. They need to have regulatory approval for therapies that have not been proven, and they have an excellent suite of ethical conditions and guidelines. It hasn't yet become law, although from my reading of the situation, most of the respectable institutions are abiding by those new rules and guidelines, even though they have not yet become law. So I think that Chinese scientists are very aware that people, companies like Beike are spoiling their reputation and making it more difficult for them to translate their own laboratory work, which is of a very, very high order, comparable to the best science we see in the West. It's remarkable how India is investing so much in great research. And this year, for the first time, China, did I say India? I meant China. China is publishing as many high-quality papers in the scientific literature as the United States, which is a remarkable feat. And they are continuing to invest. So I think that we will see in time that these cowboys are not going to be permitted to do things which they're doing. And the victims are the patients who will pay any amount of money to be cured of illnesses that cannot be currently treated or cured by other ways in the West. So, you know, that kind of behavior is going to be less and less. And I suspect even in India, where it does occur to a lesser extent, that it will also diminish in time.
Thank you. And I noticed.
Thanks.
Yes, thanks. Lawrence, you typed a question. Do you want to just say it out to the group?
Yes, I can. Can you hear me?
Okay. Yes.
Yeah.
Yeah. So, Dr. Abdallah, I'm wondering if you think that donors setting research priorities in developing countries stifles innovation from these countries.
I'm sorry, Lawrence, I missed that. Can you just repeat your question? I'm sorry.
Yeah, sure. Do you think that donors setting research agendas stifles innovation in developing countries? For example, if you look at most of the research output from developing countries in index databases, you would find most of it is on malaria, TB, and HIV, because that's where the funding is. But there are other important issues like diarrheal disease, road traffic accidents, and some of the non-communicable diseases as well, which don't have as much funding.
I think you're right that the availability of research funding which is directed to specific research questions, and also aid which is provided to build up specific silos of health services, do change the or rather impact the kinds of research that's done on the ground. What we have done in Grand Challenges Canada is open the doors for people to come up with their own ideas. So if you go to our website, grandchallenges.ca, and look at our STARS program, and look at the funding that we have provided to researchers in developing countries, you will see that the spectrum is very, very wide. We also are putting in a huge amount of money into areas that have been totally neglected in the past. For example, mental health, childhood development, neonatal and maternal reduction of mortality, and so on. So at least in Grand Challenges Canada, we're trying to do things differently. And then in the other organization where I am one of the founders, the Global Alliance for Chronic Diseases, we are focusing on chronic diseases. So recently we put in $25 million into implementation research for hypertension, another area that has been neglected in the past. And all the research is going to be carried out in the developing world. So we are trying to change that. It's something that you're right about and that we have become aware of and are trying to change.
Okay, thank you.
Joanna, I wonder whether we should now hear a few comments about the book from the panelists. I'm sure
Sure.
you want to say a few words about the books. And I also want to,
I'll just open it up if anyone feels they want to jump in with their first impression. I don't want to pick on anyone, but I will. Please just unmute your microphone and jump in with your impressions and any sort of moments of when you're reading the book, when you, I hate to sound like Oprah, but the aha moments that you may have had. So anyone?
Sure, this is Benji. I got a question. You mentioned in your book that these are really old issues regarding malaria and dengue fever, etc. But you often read about and hear about that non-communicable diseases such as diabetes, etc. They may be as a result of adoption of Western ways or Western sort of behaviors. And I wonder now, that's a new phenomenon. Now, are there any measures being taken to prevent that sort of uptake that is essentially putting them at risk?
So Benji is asking a question. We were hoping that somebody would comment about the book. So Benji, I'm going to blackmail you here and say, can you say something about the book first, and then I'll answer your question.
Sure. 2 points I really I liked about the book. One was the introduction of the critical barriers. I felt that that was a way to focus any research projects in achieving these goals. The other being, I can't recall the name, I don't have the book in front of me at this time, but the issue regarding not only coming up with solutions to these problems, but also the uptake of the knowledge after the fact, and that there's usually a lag period or a resistance to that uptake, and or a lack of ability to effectively uptake the information. Now, I see that in my daily life as well, where I'm trying to impact policies regarding health interventions, etc. And it's clearly a challenge. Now, in the 10 years that you've been involved with this, have you made any significant progress in the uptake of any sort of new technologies, etc.?
Right. So Benji ended up with yet another question, which is good. So very quickly about your first question. We talk about the West, but the West started its culturally and religiously and maybe even lifestyle from the East or the Near East. I think we are rapidly reaching a point where the whole world is going to be globalized, and terms like West and East and North and South, but more West and East, are going to become less and less meaningful. We are learning bad habits from those who started having bad habits about smoking and about overeating and not exercising. And part of this is due to having more money to spend. More and more people are becoming middle class, even in Africa, which is in some ways the last frontier. 331 million people in Africa are now middle class, so they can afford to put on weight and drive their Mercedeses. And that comes with obesity and diabetes and hypertension. The one country that I've been amazed at is Korea. I've just come from Korea, and I went around looking for obese people or overweight people, and I don't see them. It's very, very rare to see obese people in Korea, and everybody looks extremely healthy, and most of it has to do with the diet. They eat more vegetables than anybody I've ever seen. They use very little salt in their food, although we all hear of kimchi. But they actually don't eat much kimchi. It's on the side. and they do a lot of exercise. They're all sort of fanatic mountaineers and so on. So I think that if we can change people's habits to be more focused on good food, healthy food, and exercise and avoiding smoking, we would get a much better outcome. I think that with regards to the uptake of policy, I think Grandest, we refer to him in the book, Grandest Juma, this remarkable guy at Harvard, who was originally from Kenya, says that innovation and getting ideas out to where they're needed is like throwing a seed. If you throw a seed onto unprepared ground, it will not grow. But if you prepare the ground or you put it onto ground which is fertilized and healthy, then the seed will grow. And I think what has been neglected in the past is at the demand end, at the recipient end of policy. We need to learn more how to work with politicians, how to engage them early in our research projects. So the research that we are funding from the Global Alliance, we made everybody include politicians or policymakers in the research project from day one, so that when they do have results, those results will be translated. So we need to learn how to talk to policymakers and include them in the planning of the research and even on grants. There is more I can say, but we're running out of time.
Thank you. I'm just wondering if anyone else who hasn't maybe had a chance to speak has any comments about the book in particular. I'll just choose randomly. Maybe Shannon or Rebecca, do you have any reflections that you'd like to share? We have a quiet group today.
This is Shannon. Sorry.
Oh, great. Go ahead.
Here I am. This is
Good.
Shannon.
Thanks.
I enjoyed the book. I think, the one part that I was, I guess I was struggling with at the beginning was just, the reality that as opposed to sort of this idea of the grandest challenge as opposed to why we couldn't just start at the basics and providing, clean water, accessible basic medicine, food. I guess until those types of basic provisions are met, even if you have medications for people, health is still going to be touch and go, right? Without having adequate nutrition and, these are sort of things that were just brought up. But that was what was on my mind anyhow as I was going through the book.
I'll address that very, very quickly, about 30 seconds. It's not really one or the other. I think you need everything. Some of the issues that you bring up have to do with the governments providing basic services, clean water, good roads, protections for their populations, and providing the basic medicines which should be available to everybody, even in the poorest countries, under the right conditions. But if you just did that and didn't focus on developing a vaccine for malaria, developing diagnostics which are desperately needed so that what little resources you have is used properly and not by treating the wrong kinds of things. We do talk a lot about food in the book, but again, I think it's important to just say that it's not one or the other. All these things have to be addressed, and some of them have to be addressed by local politicians, aid agencies, international agencies, and we were addressing a small part of the bigger equation.
Yeah, no, thank you for that. Yeah, no, I mean, it's just, it's quite incredible that this is, I mean, it's such a, you'd think that it would be such an easy thing to, I mean, the developed world doesn't have any problems, but yeah, so it's quite, yeah, it's horrible and remarkable that there is this whole continent that is suffering needlessly and in when they shouldn't be.
Yeah. Well, you yourself, Shannon, are working on new antibiotics.
Yes,
so you can see the perspective.
Right. Yes. Right.
Okay. More comments from, what about Chi Hong Sung? I didn't hear him early on introducing him or herself.
I think he was a late arrival.
Are you there, Chi Hong Sung?
Yeah, do you want to say hello and provide your perspective? He shows as being here, so I'm just wondering if his microphone is working. Chi Hong, are you there? Maybe he doesn't have an audio capability.
Let's pick on someone else. What about Ahmed? Ahmed, what were your perspectives on the book?
Hi. I really enjoyed reading the book. Personally, I don't read books that often, but that one in particular, I really enjoyed you telling and Dr. Singer telling the personal experience, your personal experience with that actually took you to this endeavor and this developing this initiative. I really also enjoyed reading the different about different initiatives that are taking part in many parts of the world, like the vaccines in India and Bidnet's company in Tanzania. One thing that I really wanted to touch base on, and I was looking for it in the book, was other than these preventive measures that could be effective in eradicating infectious diseases, had to do with patient education or people education actually, and health literacy. For example, on how to have a safe sexual activity and like some basic measures of preventing malaria, and one of them you touched base on is the bed nets.
Yeah, right.
But I thought that there could be other, like as you just talking about, other basic measures that are really cheap to do, and they could be very effective in preventing those kind of infectious diseases.
Right. Thank you. Joanna, are we finishing at exactly top of the hour? Or?
We normally do, but I mean, if we have a few more minutes, maybe. But
I'm willing to stay on for a few more minutes if the others are, or anyone is.
You maybe address Ahmed's question. Yeah.
Well, I'm glad you enjoyed the book and the discussions on vaccines and the companies that we talked about. There is a limit to how much you can put in one book before the publishers start screening. So in terms of engaging the public, we focused more in engaging the public with regard to, oh my God, I have to go actually, with regard to community engagement in clinical trials. Excuse me. I'm going to be back in a second.
Okay. We'll probably just end shortly anyways, so we'll wait a minute or two here, if you don't mind. If you have to leave, that's understandable.
Hello. Joanna, I have to go, unfortunately.
Okay, thank you. And it's 1 o'clock, so that's fine. And thank you very much for taking time to answer. And I'm sure if anyone has any additional questions, I can forward them on to you. So thank you, Abdallah. Thank you very much. Okay, bye-bye. Have a great day. Thanks, everyone, too, as we all leave. And I just thanks a lot for taking the time out, not only today, but reading the book. So I appreciate it. And we'll be reconvening in a couple weeks, I think, with our last integrative session, so I'll send details out about that. Thanks, everyone. Have a great afternoon.